So this patient that you are seeing, you're on duty, what are you going to be focused on? It's not the facial swelling that is not the danger. The problem lies in the airway. The patient often have laryngeal edema, and laryngeal edema can be life-threatening in these patients. Apart from that, they can have pooling of secretions. So you have to do a tracheostomy if required, right? Not all of them will require. And then what are the other features that these patients may have? It's abdominal pain due to angioedema, and this is a condition which is called angioedema. The edema in the abdomen causes a pain which is not picked up, and it often leads to surgeries which are not required, and they can have swellings on other parts of the body as well, and sometimes they can have itching also. So this angioedema is actually because of problems in the complement pathway. And what are the causes? The causes are most commonly ACE inhibitors, and apart from ACE inhibitors, other drugs like NSAIDs and all can also cause it. Insect bites can cause it, and sometimes food allergies, food additives which you will never be picked up. Then there is a condition called hereditary angioedema. This is recurrent from childhood, and there is a history of in the family, and this occurs because of a complement pathway problem, that is C1 inhibitor deficiency. And the one related to ACE inhibitors and drugs is actually a problem with bradykinin, which is also related to the complement pathway. So the complement pathway is something which is related to allergy and immunology, and the differential diagnosis for this is superior vena cava syndrome, the commonest, then nephrotic syndrome, insect bites, hypothyroidism, which all cause facial swellings. So that is very important, superior vena cava syndrome. The treatment is mainly IV steroids, and we give IV antihistaminics, and there is now availability of C1 inhibitor protein either as recombinant or from plasma, and it is highly treatable. You give steroids and you get swelling in a matter of few days. So you should pick up this condition. Is again a rare condition like tetanus, which I told you, but these patients do come to the ICU and pick them up and try to identify. Diagnosis is clinical, and of course complement levels are done